Type 2 diabetes, serious health issue for many tri-state residents, but the disease can be well managed. Merritt Bates Thomas is here in her cute little flower dress and even cuter shoes to talk about healthy lifestyles with type 2 diabetes. Good morning.
Good morning, Angie.
You look great on this wonderful summer day.
Well, we coordinated.
We did coordinate and didn't even plan on it, but sometimes that happens. All right, so, you know, one of the things we hear you say, because you've talked about it, just in general, healthy lifestyles, before we got into the diabetes type 2, it just get moving.
Right. One step at a time, every step in the right direction that you can make. Starts off slow, and then just go from there. Yeah. So basically, you're looking in terms of benefits, so many. It improves the quality of your sleep. It helps reduce stress. Along the way, you find that you typically tend to start losing some weight, and that can help around lowering your blood pressure, helping lower or keep your blood lipids, cholesterol low, keeping blood sugar in check, or helping to lower it.
And why does that? Why does, even like going for a walk, why does that improve all of those conditions you just described? What's happening?
The body needs movement. And that's a way of utilizing what you've eaten. It's more or less the body's fuel. Mm-hmm. We don't like to talk about food that way, but that's basically what it is. And it's a way of utilizing those calories, getting your body moving, giving it the movement that it needs to stay healthy and to help it age as gracefully as possible.
Well, I know, and you hear this all the time in your programs, and when I taught exercise all the time, is that people already have sort of a barrage of excuses about I don't have time, can't go to the gym, can't afford the gym. Any of those things we tell ourselves. So what's your response when somebody says, I don't have time to exercise?
Start making time and see where you can whittle out maybe some time wasters. Or pick an ideal time, whether it's first thing in the morning, whether it's when you get home from work, whether it's later in the evening. But focus in on a time that's going to work with you, that's going to be sustainable for you. And start off slowly. You know, set aside just a small amount of time to begin, especially if you haven't exercised. Talk with your healthcare provider before you start off on this journey. Just make sure there aren't any barriers for you. But it does start with just that first step. And then moving on from there, your body needs a variety of movements. It needs that aerobic activity, which gets your heart pumping, and you need that at least 30 minutes a day, 5 times a week. You need flexibility with things like yoga, Pilates, Tai Chi. Especially as you age, that's going to help with balance. And then the strength training. And it doesn't have to be weightlifting. It can be wonderful resistance bands.
Which
it can be using your body, doing push-ups, pull-ups, anything to get your body moving and to help it along the way in terms of keeping it as healthy as possible.
Well, one of the things, and you've talked about this before, is having a healthy community around you that also inspires you to get somebody to walk with, an accountability partner.
An accountability partner is so important. That primary accountability partner, though, is the person you look at in the mirror every day.
That's so true.
Because bottom line, you know, you can have that exercise buddy that helps you stay on track, but looking in the mirror and saying, yes, I did do that, is so important in terms of long-term success.
It is so important and so easy. Just lace up your shoes and head on out the door. Thank you, Merritt.
Thank you, Angie.
We'll be back with more Lifestyles right after this. Stay with us.